honourable member for Calgary-Currie. To the Leader of the Official Opposition, the Premier, the member for Airdrie-Chestermere, the member for Highlands-Norwood, and maybe the Minister of Health and Wellness. Everybody quoted from documents. You've got about 35-40 minutes to have it all ready for tabling at the appropriate tabling time. The honourable member for Calgary-Currie.
Thank you very much, Mr. Speaker. Mr. Speaker, the Quality Council of Alberta, created by the government 20 years ago, is a completely independent, self-supporting entity with a mission to promote the use of quality methods in both the private and public sectors, says that it is extremely concerned with the decision to charter the Health Quality Council to investigate recent allegations concerning the healthcare system. The QCA has reviewed the HQCA's research on 2 previous occasions and described the 2010 Satisfaction Survey and the 2009 ER Patient Experience Report as junk science. Mr. Speaker, I will table those documents. To the Premier, will he now do the right thing and call the full public inquiry that my colleagues in the opposition have been...
Mr. Speaker, as I said countless times in the House, and I continue to say that this matter is all going to the Health Quality Council. They will do a good job in evaluating all of the evidence, all of the allegations that are going to come forward once the terms of reference are set, and the membership of that council is made public.
Well, Mr. Speaker, given the QCA's charge that the Health Quality Council pretended, and I quote, that a 38% response rate on a discretionary sample qualifies as a random sample, it doesn't, end quote, and that the 2010 report is, quoting again, guilty of flagrant overreaching, can the Premier perhaps explain to a sceptical public why they should trust the results of a Health Quality Council review?
The Honourable Premier.
Speaker, the Health Quality Council has the respect of Albertans. They've done very good work in the past, and they'll continue to do that. And this matter is going forward to the Health Quality Council. And the sooner we can get it to the Council and resolve a lot of these issues and just settle down many of the allegations, all of which have been totally non-supported by any evidence.
The honourable member.
Thank you, Mr. Speaker. When the QCA says that it does not believe these past efforts of the Health Quality Council have demonstrated the level of quality that would warrant entrusting it with this new and important investigation, will the Premier enlighten us as to how he expects this review of theirs to clear the air?
The Honourable Premier.
Mr. Speaker, in the direction I gave the Minister of Health, I wanted him to ask the Health Quality Council to look at waiting times in emergency, look at waiting times in cancer treatment, and look at how best to ensure that those waiting times are reduced, given the 5-year funding commitment that's going forward, given the fact that we're training 2,000 more nurses by 2012. All of those huge increases in not only dollars going to health, but also in staffing. And these other allegations that have been raised in the House, we're waiting for further proof.
The honourable member for Calgary, both followed by the honourable